RIT Ready COVID-19, RIT Student Safety Plan Training. Guiding Principles. RIT's guiding principles for responding to the COVID-19 pandemic are rooted in the concern for the health and safety of our students, faculty, staff, visitors, and other invited guests. Our plans are aligned and consistent with the applicable local, state, and federal laws, as well as the guidelines published as part of New York Forward, a guide to reopening New York and building back better, titled New York Forward. Our plans recognize our shared responsibility for keeping the RIT community healthy and safe and include symptom monitoring, physical distancing, reducing the density of individuals on RIT campus, personal safety practices, regular cleaning and disinfection, restricting non-essential travel, contact tracing, and communication. RIT requirements may change if federal, state, or local guidelines change. Training note: all students who are a part of the RIT community should complete this educational course related to COVID-19 and determine how we can each play an active role in creating a healthy and safe campus environment. There may be additional COVID-19 trainings you will be required to complete based on your academic area of study and/or your engagement with specific events or activities. Objectives: understand COVID-19 and related symptoms, understand how COVID-19 is spread, understand safety protocols at RIT, including personal protective equipment, PPE, and face coverings, hand hygiene, physical distancing, health monitoring, cleaning, and facility guidance. Understand RIT's expectations of people returning to campus. Provide contacts and resources, acknowledgement, and sign-off.
What is COVID-19? Coronavirus disease 2019, or COVID-19, is caused by the virus SARS-CoV-2. Symptoms can appear as early as 2 or up to 14 days after exposure to the virus. The usual onset is between 5 and 7 days. It is possible for individuals to spread the virus for up to 2 days prior to the development of symptoms. It is possible for people without symptoms to be carriers of the virus and unknowingly spread COVID-19. These are the most common symptoms associated with COVID-19, but symptoms may also include items not mentioned on the list. New loss of taste or smell, chills or fever of 100 degrees or higher, sore throat, not due to allergies, feeling like coming down with an illness, fatigue, or muscle aches, new cough or change in your cough, new or worsening shortness of breath or difficulty breathing, abdominal pain, nausea, vomiting, diarrhea, or loss of appetite, congestion or runny nose not related to allergies. Call the Student Health Center at 585-475-2255 if you learn or suspect that you have contact with a confirmed case of COVID-19. It is important to remember that people can shed virus and be infectious even if they don't have symptoms. This is called asymptomatic transmission. How does the virus spread? Between people who are close in contact with each other. Respiratory droplets are produced when a person talks, coughs, or sneezes. Droplets can land in the mouth and nose of nearby people or can be inhaled into the lungs. Smaller droplets, called aerosols, are a larger concern in poorly ventilated spaces. Aerosols are smaller in size, meaning they can be in the air longer and travel farther. It may be possible to get COVID-19 by touching a surface that has the virus on it, then touching your own mouth, nose, or eyes, but this is not thought to be the primary way the virus spreads. General practices. Fill out the RIT Daily Health Screen 7 days a week, whether or not you are coming to campus. Wear your mask. Wash your hands. Watch your distance. Stay home if you are sick. Check in to posted locations for contact tracing. Testing prior to arrival on campus. All faculty, staff, and students are responsible for getting a COVID-19 test prior to coming to campus and must provide evidence of a negative result in order to return. Fill out the RIT Daily Health Screen. COVID-19 tests must be taken and results submitted within 14 days of returning to campus. To assist with system monitoring, faculty, staff, and students must complete the RIT Daily Health Screen every day, 7 days a week, whether or not they are coming to campus. Wear a mask. Masks must be worn indoors except when alone in a private space. Can be removed in appropriate dining areas when seated, according to posted signs. Are required outdoors when 6 feet of distancing cannot be maintained. Limit the risk of illness transmission to others. Are not a substitute for physical distancing. Face covering options. RIT will provide faculty, staff, and students with both a cloth face mask covering and a clear, accessible mask free of charge. Disposable masks will also be made available if you lose or forget your face covering. It is recommended that you use the RIT issued masks, but you may use your own face covering provided that there are 2 or more layers of fabric. It fully covers your nose and mouth. It is form-fitting around the face with no large gaps. And it is in good condition. Acceptable face coverings include cloth face coverings. Accessible masks, a cloth face covering with a clear plastic area. Surgical masks. Disposable masks. N95 respirators without a valve. Masks with valves are not approved. Proper face covering use. Wash your hands before putting on the mask. Place it over your nose and mouth. Loop the straps behind your ear or tie the straps around your head. If available, pinch the metal nose bridge to fit your face. Make sure you can breathe easily. Do not touch the outside portion of a mask and never share face masks. Face covering care. For cloth masks and accessible masks, the cloth mask with a clear area, wash after each use. Hand washing the masks is preferred. Wash with soap and water for at least 20 seconds and allow to air dry. If laundering, wash on gentle cycle in hot water and allow to air dry. Store masks in a clean location, such as ventilated containers or a paper bag. Label container appropriately. If the mask becomes damaged, discard in the regular trash. Disposable masks, surgical masks, and N95s. They are not intended for reuse. Do not use if the mask is soiled or damaged. Discard mask in the regular trash. Wash your hands. Wash your hands with soap and water for at least 20 seconds. After using shared equipment. After blowing your nose, coughing, or sneezing. After removing gloves or a mask. Before entering and after exiting an area, for example, lab spaces, dining facilities, or classrooms. After using the restroom. Make sure you use enough soap to create a good lather. Wash front and back sides of hands. Wash between fingers. Rinse and thoroughly dry. If soap and water is not available, use hand sanitizer that contains at least 60% alcohol. Cover both hands entirely and rub together until dry. Avoid touching mouth, nose, and eyes with unwashed hands. Gloves. Gloves are not recommended to be worn in public because they can do more harm than good in spreading COVID-19. Hand washing is more effective to prevent the spread of disease than wearing gloves. Wearing gloves should be done as prescribed in certain areas, such as lab spaces. While cleaning or disinfecting, you can wear gloves as prescribed on the product label. Always wash your hands after removing gloves. Watch your distance. Provide 6 feet of separation from others. Limit group gatherings to 10 people or less. Follow queuing line markers and physical distancing signage. Refrain from carpooling with others. Ensure adequate separation between work and study stations. Set up spaces to ensure 6 feet of physical distancing all around you. If possible, stagger seats and study spaces. Do not congregate during meals. Consume food items in a private location or outside. Use virtual meetings and phone calls when needed for gatherings or academic projects. Obey the COVID maximum occupancy signs, including elevators. Cleaning and disinfecting. Cleaning refers to the removal of germs, dirt, and impurities from surfaces. It does not kill germs, but by removing them, it lowers the number of germs and the risk of spreading infection. Disinfecting refers to using chemicals, EPA-registered disinfectants, to kill germs on surfaces. This process does not necessarily remove all of the germs, but it can lower the risk of spreading infection. How often should I clean? Clean and disinfect high-touch surfaces with household cleaners and EPA-registered disinfectants daily. Examples of high-touch surfaces are tables, doorknobs, light switches, handles, desks, toilets, faucets, sinks, electronics. Clean and disinfect other areas and surfaces once or twice a week or whenever soiled. Steps for safe and effective disinfectant use. Pathocide is the RIT-provided EPA-approved disinfectant to be used in university spaces. FMS will place bottles in RIT learning spaces. Gloves are not required to use Pathocide unless irritation occurs. Pre-clean the surface to be disinfected with soap and water if the surface is visibly dirty. Spray the Pathocide on hard surfaces and touch points and let dwell for 10 minutes or until dry. For electronics, touchpads, screens, and other liquid-sensitive surfaces, spray on a paper towel and wipe. Wash your hands thoroughly for 20 seconds after using Pathocide. Stay home if you are ill. Complete your RIT daily health screen. If you have symptoms, you will be instructed to stay home and contact the Student Health Center at 585-475-2255 for follow-up. Students may be asked to quarantine or isolate. Students with symptoms or those who are instructed to stay home by the daily health screen are required to be in contact with a Student Health Center. They may be asked to quarantine or isolate. Isolation and quarantine. What's the difference between isolation and quarantine? Isolation entirely separates sick people with contagious disease from people who are not sick. Quarantine separates and restricts the movement of people who may have been exposed to a contagious disease for the length of time necessary to determine if they become sick. If you live in campus housing and cannot quarantine or isolate in place, you will be moved to an RIT designated quarantine or isolation living space. If you live off campus, you will be expected to quarantine or isolate in place. If you do not have a suitable isolation space, the Monroe County Department of Health may be able to assist you in securing such a place. Contact tracing. If you have COVID-19, the healthcare team that ordered the COVID test will notify you of your results. A representative from the health department will call you to check on your health, discuss who you've been in contact with, and ask you to stay home to self-isolate. It is important that you are as responsive and accurate as you can be during that call. If you have been in close contact with a person who has COVID-19, someone from the health department and/or RIT Student Health Center will call you to let you know you've been exposed and review all the steps of self-quarantine. The RIT community is expected to support and comply with contact tracing efforts by providing information relating to individuals with whom they may have had close contact while on campus. Location check-in. RIT has developed the Location Check-in application, a web-based application for use on campus to aid in contact tracing efforts. Location Check-in uses unique QR codes to associate individuals' locations, such as classrooms, office areas, with frequent visitors and use of RIT shuttles. Using a smartphone or web browser, faculty, staff, and students must scan the QR code or enter the information directly on the Location Check-in website every time they enter these spaces. Non-compliance. RIT takes accountability for following the COVID-19 guidance seriously. We encourage everyone to follow the rules themselves. Help others via positive role modeling and reminders, and report concerns that are not otherwise resolved. A central reporting form will be available to the RIT community beginning August 3rd, 2020. Individuals can report behavior that is concerning through this form. Student cases will be managed by Student Affairs Accountability and Conduct. Individuals are not required to directly confront anyone about non-compliance.
Your mental and emotional well-being. COVID-19 has altered many facets of life for students. These changes can take a toll on your emotional well-being and may result in stress, an impact on academics, fear, and/or anxiety. Know the resources and services that are available to support you. For example, the Counseling and Psychological Services at RIT, the Student Health Center at RIT, Spirituality and Religious Life at RIT, New York State COVID-19 Crisis Line, Mental Health and Coping During COVID-19 through the CDC. Contacts and resources. Timely and accurate communication is central to the success of the response to the COVID-19 pandemic. The latest information on reopening plans, health and safety best practices, FAQs, and other pandemic-related information can be found at www.rit.edu/ready. For further questions, RIT has established a call center at 585-475-3500 or 1-833-323-0002. All members of the RIT community are required to follow this pledge. I pledge to protect myself and others by wearing a mask when in public, washing my hands frequently for 20 seconds each time, and using hand sanitizer. Watching my physical distance, staying 6 feet apart as much as possible. I pledge to prevent the spread of COVID-19 by practicing daily self-care, keeping shared spaces clean, using the Daily Health Screen website before coming to campus, using the contact tracing QR codes when I'm moving about campus, contacting my health care provider, the RIT Student Health Center, or on-campus Rochester Regional Health Office if I have any COVID-19 symptoms, staying home when I feel sick. I pledge to prepare to keep safe by staying informed and adhering to university guidelines, following directional signage throughout campus, keeping important supplies with me at all times, such as masks, hand sanitizer, etc. Together, we can stay RIT ready and minimize the spread of the coronavirus.